With age, the ability to synthesize glucosamine decreases. The less glucosamine the body produces, the more the joints hurt. I scoured the internet and I found 3 good complexes. If you are smart, don't use animal flex when you got a problem. But still, my favorite complex is... Hi everyone, today we are gonna talk about the 3 best nutritional complexes for joints, ligaments and muscles. I asked myself this question for a reason. I was looking for the best complex for myself. And now I want to share with you what complexes for joints and ligaments I have chosen. Before we begin, a little backstory. In 2018, I had surgery on my right hip joint. In a completely mystical way, a calcification was growing into my hip joint, gradually destroying it. I was doing stretching at that time, and most likely I had slightly torn the tendon of the quadriceps femoris. My body decided to repair this injury with calcium, and I found this calcium outgrowth on my own at the ultrasound. I had a slight pain when walking and decided to check why. I put the probe to the place of pain and saw something that looked like a bone fragment. Then I took an X-ray, MRI and found a great surgeon in St. Petersburg. He operated on me. Next was hellish months on crutches. I pumped my leg and back muscles every single day. I experienced domestic difficulties every day, physically, mentally and emotionally overcome. My endless gratitude to the man who was with me during that most difficult time of my life and helped me a lot. Write in the comments if you had any injuries, fractures, serious illnesses with disabilities, how you supported yourself, who helped you, what helped you during that period. So at that time I was looking for the best complex for my joints and muscles. I scoured the internet studying what ingredients should be in the composition, in what form, in what dosage, etc. And I found 3 good complexes. But first things first. At the beginning I will tell you what components are most beneficial for joints, ligaments and muscles. Then I will move on to the nutrient complexes. So first component is chondroitin. Chondroitin sulfate is involved in the construction of the main substance of cartilage and bone tissue. It has chondroprotective properties, enhances metabolic processes in different types of cartilage, inhibits enzymes that cause the destruction of articular cartilage, stimulates the production of proteoglycans by chondrocytes. These are complex proteins that act as lubricants in joints. Chondroitin sulfate has an anti-inflammatory function, helping to reduce the release into the synovial fluid of inflammatory mediators and pain factors. Also, chondroitin sulfate slows the progression of osteoarthritis and osteochondrosis. That is, it slows the destruction of bone tissue and reduces calcium loss, accelerates the repair of bone tissue, helps restore the joint capsule and cartilage surfaces of joints, normalizes the production of joint fluid. The next component is glucosamine. Glucosamine stimulates the synthesis of proteoglycans and hyaluronic acid synovial fluid, restores enzymatic processes in the cells of the synovial membrane and articular cartilage. It facilitates normal deposition of calcium in bone tissue, inhibits the development of degenerative processes in joints, restores their function and reduces pain. In other words, glucosamine is the building material for cartilage, which is used for the formation of new connective tissue. Connective tissue is found in cartilage, ligaments, tendons, synovial fluid, bones, muscles, nails, hair and skin. With age, the ability to synthesize glucosamine decreases. The cartilage in the joint is regenerated, renewed more slowly and also rubs off, so a person feels pain when moving. The less glucosamine the body produces, the faster the cartilage in the joints is erased and the more the joints hurt. Typical dosage is 1500 mg for glucosamine sulfate and 1200 mg for chondroitin sulfate taken once daily. For body weight less than 45 kg, loss, the dose is generally reduced to 1000 milligrams for glucosamine sulfate and 800 milligrams for chondroitin sulfate. Moreover, the effectiveness of 1200 milligrams glucosamine sulfate in a single daily dose does not differ from the effectiveness of 400 milligrams 3 times daily intake of glucosamine sulfate. However, adherence to therapy, that is, the likelihood that a person will not forget to take a pill, is high in a single dose of medication. Therefore, taking a nutrient once a day would be an additional plus. When taken orally, glucosamine sulfate is easily absorbed into the body and can be traced to the cartilage as early as 4 hours after ingestion. Glucosamine hydrochloride, another form of glucosamine, is available as a nutritional supplement and is considered to be as effective as the sulfate form. The duration of the course is determined by your doctor and is usually 2-4 months. Let's move on to the nutritional complexes. Animal Flex, an excellent complex from Universal Nutrition, USA. It contains 3 full-fledged joint complexes. The first one, the joint construction complex, includes glucosamine, methylsulfonylmethane MSM, chondroitin sulfate A, and chondroitin sulfate C in the total dosage of 3000 milligrams per serving. By the way, MSM is an organic sulfur-containing substance that is a part of connective tissue proteins, collagen, elastin, keratin. The second complex is the joint lubrication complex, consisting of flaxseed oil and cetyl myristoylate proprietary blend. For more information on myristoylic acid and other fatty acids, check out my video 2 amazing vitamins for beautiful skin and hair, link in the description. The third complex is represented by the joint support complex, namely ginger root, turmeric root, boswellia, quercetin, and bromelain. These natural ingredients can have beneficial effects on the immune system and on important enzymes involved in maintaining tissue health. Also included in Animal Flex are small doses of vitamin C and vitamin E, zinc, selenium, and manganese. I liked the phrase on the package: if you are smart, don't use Animal Flex when you got a problem. You can and should use it to help prevent problems from arising in the first place. This principle can be applied to medicine in general. It is easier to prevent than to treat. The next medication is Theraflex from the German company Bayer. 1 capsule of Theraflex contains 500 mg of glucosamine hydrochloride and 400 mg of chondroitin sulfate sodium. Adults and children over 15 years of age are prescribed 1 capsule 3 times per day for the first 3 weeks and 1 capsule 2 times per day for subsequent days. Recommended duration of treatment is 3 to 6 months. As I said before, glucosamine hydrochloride is considered to be as effective as the sulfate form, but hydrochloride form of glucosamine is more available for absorption into the body, and a smaller dose delivers an equivalent amount in the system. However, apparently glucosamine sulfate has a better safety profile. Glucosamine sulfate is likely safe in most adults. Glucosamine hydrochloride is possibly safe for most adults. In addition, it is not only the form of the drug that affects its absorption. Normal functioning of the gastrointestinal tract, gastric acidity, enzyme production, bile flow, intestinal peristalsis, and of course, proper nutrition and adequate water consumption are very important. Let's move on to the third complex, Geladrink Forte from the Czech company Orlink. Geladrink Forte contains a complex of chondroprotectors, peptide collagen hydrolysate Gelita 8000 milligrams. This peptide collagen hydrolysate affects the activity of cartilage and bone cells, accelerating the healing processes of cartilage tissue. Geladrink Forte, of course, contains glucosamine sulfate 1500 mg, chondroitin sulfate 800 mg, methylsulfonylmethane MSM, as well as micro and macronutrients and essential vitamins, Boswellia serrata, vitamin C, vitamin E, selenium, selenium and manganese. It comes in capsule and powder form in different flavors: pineapple, orange, strawberry. The course of taking the supplement is usually 2-3 months. Contraindications for the use of these 3 nutritional complexes: hypersensitivity to the components of the drugs, pregnancy and breastfeeding. Theraflex is contraindicated in children under 15 years of age and in severe renal failure. Animal Flex and Geladrink Forte are dietary supplements. No contraindications are listed for children. Children need dosage adjustments according to age, weight and height. In any case, consult your doctor before taking any medication. All complexes should be used with caution in the following cases: simultaneous use with direct-acting anticoagulants, susceptibility to bleeding, thrombophlebitis, in chronic diseases, especially in diabetes, asthma, heart failure, and kidney failure. In my humble opinion, all 3 complexes work well. At least my joints liked all of them, but still my favorite complex is Animal Flex. Excellent composition, good tolerance, convenient packaging. Of course, in addition to the supplements described in this video, there are many other medications for joints, ligaments, and muscles on the market. Consult your doctor to choose the best one for you. That's all for today. Subscribe to my channel, write comments, I read them with pleasure. Many of them I take into account. Thank you very much for watching to the end. Take care of your body, mind, and joints.